Our older pets are indeed less likely to have obesity as compared to their middle-aged counterparts, and they are more likely to suffer from chronic health conditions which can impact their food intake and maintenance of body weight. Additionally, like in people, we may also observe sarcopenia or loss of muscle mass in our aging pets, and this applies to both species. So far, we don't have clear evidence of differences in nutrient absorption between, say, young and geriatric dogs. However, there does seem to be some evidence that senior cats demonstrate a decreased efficiency at digesting fat. So my answer here is yes, and I would say especially for those patients with obesity. Even if it is difficult to know if weight loss would impact the duration of the pet's life, there remains potential to improve a pet's comfort level, their mobility. We know that many aging pets suffer from osteoarthritis, and their overall quality of life, which is so important. And even if the pet doesn't reach, say, a target body weight, loss of a small amount of excessive body weight may still benefit their health and well-being. For an underweight senior pet, the first and most important step is to do a thorough physical exam and comprehensive medical workup, including gathering a detailed dietary history to try to establish the cause of the underweight condition. The medical and nutritional therapy should then be guided by your findings. For example, perhaps the pet has a decreased appetite due to oral pain from periodontal disease, which requires treatment. Or perhaps you may find that the pet is actually completely healthy, but is maybe fed the same low-calorie, high-fiber weight management diet as their housemate for convenience, and they simply would benefit from a more energy-dense, low-fiber option to facilitate some weight gain. Same general principle of reduced energy intake through caloric restriction applies to senior pets as to those who are younger. As mentioned, senior pets may be more likely, though, to have a concurrent chronic condition that is also nutritionally responsive. So in these cases, whether a therapeutic weight loss diet is appropriate and the degree to which you can safely restrict their energy intake will depend on the presence or absence of comorbid conditions for which that patient requires an opposing therapeutic diet. For example, chronic kidney disease. If a therapeutic weight loss diet is not appropriate for the patient, it may still be possible to achieve weight loss safely, but the rate of weight loss targeted will be much slower. In these cases, consultation with a board-certified nutritionist may be useful to help you to identify the best diet for managing the patient's comorbidities.